Thanks to you at home for joining us this hour. The president today went to Yuma, Arizona to talk about his border wall. You might remember that Yuma Regional Medical Center last month hit capacity in terms of hospital beds and in terms of ICU beds. Yuma, Arizona was actually one of the first places in the country outside of New York where we really did see hospitals being overtopped, hospitals being so full with critically ill coronavirus patients that they had to start shipping patients out to other hospitals in other cities and in other parts of that state. Well, if you go 1 hour due west from Yuma, where the president was today, you will find the El Centro Regional Hospital in El Centro, California, which is the county seat for Imperial County, California. And at the El Centro Regional Hospital, right now, they are in extremis. This is Christina Santana, who works at El Centro Regional Medical as a nurse.
Hello. So today has been a rough day. It's kind of what we expect now every day we come to work. Just prepare for the worst and brace yourself to what lies ahead during the day. It's just very sad and unfortunate, and I really never thought I'd see any of this in my lifetime, but our little town is getting ransacked and beat up by this horrible monster that is the coronavirus. Now it's beginning to infiltrate our community, well-known people. We're all such a small community that it's starting to hit home, and it's starting to wipe out families. And it's just a constant anxiety of realizing that the people you take care of are probably not going to make it most of the time. I'm starting to understand what PTSD looks like. It's like this. It's wartime. It's constant suffering and death and dying and going on to the next one and doing your best, doing everything that you went to school for. And sometimes everything you do is not enough, and everyday things change. And we don't see an end. The numbers keep going up. The patients keep coming in. And it's just causing complete havoc in our little community. And then just to see that they want to open everything back up and back to normal, and everyone say, oh, this is like the flu. This is not the flu. This is a monster, and it wreaks havoc on your entire body, not just your lungs. It's a whole systematic disease. And we're tired. We're tired. We're exhausted physically, mentally, everything. I don't see how we continue, but we do, and we will take this on head first and just do the best we can and help as many people as we can, and just keep trucking every day when we come in.
I primarily work the COVID tent. We can see up to 29 at a time out there between the tent and the car. There are multiple patients that start with us in triage and are not stable. So we have to rush them inside where they can get better care that we can provide in the tent. What I've learned is that sometimes this is the last time these families will ever see their patient again. Sometimes these patients are dead within 3-4 hours. We are so full and have so many critical patients that the state is helping us to find ICU beds all over California. And so we're constantly flying out patients, fixed wing and helicopter, as far away as Berkeley and Stanford. And because of the way COVID is, they're not allowed to see their family even if they are hospitalized. So it can be weeks before they see their family, or it can be the last time that they see their family.
So I get asked by my friends and family, how's work? And I never really know how to answer. Working as a respiratory therapist during this time it's been difficult. And I know one of the things that I've really been struggling with and processing is how quickly a lot of these patients deteriorate, how they go from walking and talking to being intubated to being pronounced dead within a matter of hours, and knowing that there's no family members around for them to say goodbye. It's rough. It's very rough.
Good morning. My name is Judy Cruz. I'm the director from El Centro Regional Medical Center's ER. Today has been one of the worst days by far. All of our beds are full. There are 12 patients waiting for admission to ICU, which we have no beds, so that means we're pending transfer. We have to look for beds in another hospital. This is very taxing, time-consuming. Some of these patients have been here 2 to 3 days waiting for beds. Half of them are intubated on ventilators. One of them required CPR for the first 3 hours of our shift. That means 4 nurses, a respiratory therapist, a physician in that room the entire 3 hours. And unfortunately, he lost his battle to the coronavirus. When I walk out of this office, I'm gonna go out there and tell the staff what an amazing job they're doing and have been doing and how proud I am of them. But just know that we're all praying that this comes to an end soon. And we just want to go back to normal.
We just want it to go back to normal. That's the medical director of the ER at El Centro Medical Center in El Centro, California, which is, again, is the county seat of Imperial County. You also saw nurses and a respiratory therapist who work there at El Centro. That hospital is in Southern California. It's basically an hour due west of where the president visited today for his event hyping the idea of his border wall. In the state of California, they hit a new record number of cases on Sunday this weekend, more than 4,500 new cases reported in one day. Then the next day, Monday, yesterday, they broke that record and they got over 5,000 new cases in a day. Then today, California broke that record and got more than 6,000 new cases in a day. Things are going poorly in California. And that's a snapshot that we just saw of how things are at one already incredibly hard-hit hospital in the southern part of the state.